Episode 22, Froning and Friends.
Yes, sir.
Dr. Sean, Sean Goddard or Kristopher Goddard?
So I confuse everybody. It's
Okay.
Kristopher Joseph Sean, and so my friends call me Sean,
Okay.
and professional everybody calls me Kristopher.
Oh, okay.
So
Gotcha.
I'm gonna end up transferring to Sean, but right
Yesterday-
now I have a dual
dual
And
identity.
I'll be honest, the first time when I had the first procedure, I was like, Sean, I'm pretty sure his name's Sean, and then the other Sean, and I was like, did I confuse the names? And then your jacket said Kristopher, and I was just like, crap.
That's what I said
And I was
yesterday.
like, man, I don't
which
want
is-
to call the guy the wrong name who's sticking needles in my knee, but.
He's like, what's my
And
name?
then he's like, so what's the deal? Why'd his shirt say Kristopher?
Your lab
Or his
coat.
lab coat,
Your
yeah.
lab coat says
He's like, it has a
Kristopher, and I was
different
like,
name.
Which is it?
Everybody's like, "Are you the brother?" Like, I really didn't want you. No, so I get that a lot. So I'm going to start transitioning to Sean. I did it because when I first got out, I thought I had to have my first name on all my legal stuff.
Yep.
So if people look up my license, they see Kristopher.
Yep.
But it has my middle names, but nobody ever looks at middle names. So.
Right.
And that's why I thought I better have Kristopher there just in case. But now everybody's telling me, no, you just need to put your name on there.
Right.
You go with what you
go
go
with.
with.
What you go with. Yeah, for years, like when I first registered for the CrossFit Games, I put Junior on there just
Right.
because it said, I had a space for suffix, so I put Junior in there. So then for years it was like Rich Froning Jr. and I was like not like the Junior's not a huge part of, but it was like everybody stuck on the Junior. I was like, okay, we don't have to use the Junior part.
Right.
And so it's kind of a similar thing.
Yeah, definitely so.
Yeah, you
You
get
just don't
caught
know
up.
what to put, so you're like, okay, I'm going to do this.
Just do this. Yeah.
Well, this should be fun because I got to see the procedure yesterday, and Ellie hasn't, and she went and studied a ton, so she's going to come at you with facts and stories. So
Oh yeah, and you can dispel any stories
Any
or facts
myths,
that
any
she
stories.
thinks she's found.
I can't wait.
I'm not a doctor today.
I'll give
No.
a little background though first on kind of what happened. So I tore my meniscus last year at regionals, or right before regionals. Sorry, the week before regionals. Kind of trained through it through regionals training, made it through regionals. The games, did a couple cortisone shots, and then had surgery the week after the games, and then it just wasn't healing properly the way I felt it should. And mutual friend Ron Ortiz, the godfather of CrossFit, was like, hey,
Godfather.
I got a guy. And so we connected, I guess, back, when was it?
Man, I think I
About a
came in
month ago?
February,
Yeah, February.
when I first went by your house.
Yeah. So Ron's like, yeah, he's got a practice in Miami and a practice in Knoxville. And I was like, wait, what?
Right.
That's two random places. And he's like, he's got to come through Knoxville.
Literally the next day.
yeah.
Like, he's like, because I saw Ron, then the next day I was flying up, and he said, okay, just talk to Rich. Go by his house tomorrow.
Yeah. So he shows up to my house with an ultrasound machine and just kind of like scans my. He's like, yeah, your LCL, your MCL are both kind of loose. Your ACL is a little loose. He's like,
Right.
I think we can shore that stuff up, and kind of away we went after that.
Well, and even kind of more happenstance or strange. I used to fly to Knoxville, and I had to do indirect flights. To a stopover, get there. But a couple times, I almost, the connection was delayed. Almost missed it, and so I was like, I better fly to Nashville from now on and drive to Knoxville.
yeah.
And so, of course, Cookville's right on the way.
Oh, wow.
Right on the way.
Perfect.
Made it even work
Fortuitous.
better. I'm like, well, literally, it's on my way.
Let's do it. Yeah,
It's not gonna. And yeah, so I looked at it, and at that, then your knee was pretty swollen.
Yeah,
still.
super swollen. And I was taking meloxicam every day. I mean, I'd taken meloxicam every day almost for a year, and it was still really swollen, like inhibiting where the back of my knee would get so swollen that I couldn't squat. The Baker cyst or popliteal cyst, whatever you want to call it, would get so swollen that I couldn't even squat.
Yep.
And so just did our third treatment yesterday.
Yep. And so after I saw you, got the surgical report, and they had taken meniscus, some cartilage, and then in my mind, it comes down to, okay, I know I can tighten the knee.
Right.
There's no doubt in my mind about that. The question is, can we actually regrow these things? And after surgery, we never know for sure, unfortunately.
Yeah.
We know we're going to help it and at least prevent progression, and help shore up any kind of injury in the meniscus and the cartilage. And optimistically, there's been some case studies where you have regrown that stuff, but
right.
we don't know for sure. But I know we can stabilize, and I knew the swelling would improve.
Right.
And so now the third treatment yesterday, but after two treatments, I'll let
yeah.
you talk about how you feel.
I've done. I got back to where I can squat regularly. Olympic lifting is still kind of. I've got to watch the volume on that, but I mean, as long as I'm smart about stuff, I've been running a lot more. 5K 2 or 3 times a week in intervals. And so as long as I manage that and am smart kind of about how that goes about, it's been really good so far, and I'm not taking meloxicam anymore. So that's been the biggest thing, is the swelling that I've noticed so far. And the pain wasn't too bad. It felt like somebody was, when I say too bad, felt like somebody was stabbing with an ice pick every step I took.
That's not too bad.
That's not bad.
Jeez.
But now it doesn't feel like that, so that's a good thing too. And so I'm excited to see what the third treatment, because you said you thought after the third treatment we'd see the most, but after the second treatment I saw, I was back to probably 85-90% before this last treatment. So
Yeah, due to your severity, I knew the first 2 are going to be important, especially, we were able to do them close together.
back to back, almost basically a week apart.
Which was really good. Anytime going back to any kind of activity or performance, it's nice to be able to do them close together.
Right.
And then this third one's just going to help shore up. And like I told you yesterday, sometimes we alter a little bit.
Right.
And so, you were telling me in the Olympic deadlifts, you felt it in the back. And so really, I targeted those other 2 areas. I think that'll help out.
Help a little bit.
Yeah.
Cool.
Sometimes we have to, be a little flexible in the treatment plan, but I really do.
Cool. Yeah, like I said, it's as bad as 19 or 18 injections, I think, the first time we did, because you do a little bit of lidocaine first, and then, I don't know, yesterday, I feel like we did a couple less. We did a little bit more volume in the shots, is what it felt like.
Yeah, there were
yesterday,
8 yesterday.
Yeah.
Well, 8 lidocaine, then 8.
8, so 16 instead of 18. Well, and then we did 17 technically, because we did my right knee, because I've had some tendonitis in my right knee that I've dealt with for, I think, probably had something to do with the meniscus. Yeah.
Well, and I don't think it's actually tendonitis. I really feel like it's
Scar
a
tissue?
ligament or scar tissue from the surgery.
Okay.
So,
Yeah.
because I don't know, I train hands-on.
Yeah.
For years, that's all I did before I got heavy into the injections, and so I can just feel that tissue, and something's a little off in that
Something's
tissue.
not right.
Yeah, but it's not a typical tendonitis that I would feel.
Oh, okay.
So I really feel like it's just scar tissue, and these injections work for that too, which is good.
Yeah, we'll see.
We had meniscus surgery the same day.
Same day.
And then
Surgery buddies.
Yeah.
High-fived, one
And
in,
then-
one out.
So I was there when he was starting to rehab, and I think it's so good to see you starting to feel good again.
Yeah.
And feel
It's
like
been
you're
frustrating. Real frustrating.
Well, it's interesting. I haven't asked somebody on the outside that's seen him for a long time.
Yeah.
How have you seen from that surgery and through this process?
Well, he's super frustrated. Trying to feel good, trying to train, try to be in that space that you're supposed to be in, get after it. And now he's back, looking more like himself, so to speak. So you can
That's
tell.
great.
You can tell something's different.
Yeah.
Well, there's nothing more disconcerting, too, than someone goes and gets surgery and you expect, okay, he's going to heal and be semi-normal and walking normally. Like, you literally were dragging your leg behind you for
Months.
weeks after the
Months,
surgery,
yeah.
and it was like, that's odd. Maybe there's a rock in his shoe or something. Like, it was that
Right.
noticeable
There's a
that
rock
he was...
in my knee.
And truly, I think it was probably 2 or 3 weeks ago. It was the first time I was like, wow, it looks like you're actually walking without a
limp,
kind of
yeah.
a limp, really.
Yeah.
Well, you've worked on his leg, trying to get the
Yeah.
inflammation out. And,
Oh, there was so much inflammation.
And
it was
just kept
unbelievable.
going from what I hear.
yeah.
Had cankles for a while.
Yeah, I-
drifted around.
Pretty sure I ruptured that popliteal cyst at one point. It looked like my leg looked like a sausage that was about to pop. It didn't hurt, but I was like, oh, this is great.
There's so
it's
much
gone. But then
pressure.
all of a sudden it came back. So it's just like, son of a.
Yeah.
So it's been frustrating.
Yeah, until you heal those injuries, it really keeps
Yeah,
going.
just
and I think your case a little different. I think the possibly surgery helped facilitate some of that.
Right.
But so many people do feel better.
Mm-hmm.
But long term, the body's great at adapting to injury and pain, and that's why you're able to work out through it.
Right.
Even the whole process. But then what happens 5, 10, 20 years later?
Yeah.
And that's when you really see the injuries happen. That's what I've noticed in my practices. People, 40 years ago I hurt my knee, and now it's bone on bone, and they're only 50 years old, or a lot earlier than it should have happened. So
Yeah.
we know trauma facilitates arthritis and other injuries, and it's just a matter of, okay, what can we do early on to help it? And especially being an athlete too, we're more aggressive with athletes than, for obvious reasons. You're doing it for work or to make a living.
Right.
So it makes a big difference.
There'll be a lot of people that are watching that don't have any sort of background at all in stem cell. So could you kind of set the stage, give us a little of your background, and talk a little bit about technically what it is and
Why you chose stem cell and just some things like that?
For sure. So kind of started at the beginning. I was an undergrad over at Tennessee, and I got a biochemistry degree. I got minors in mathematics, religious studies, and I always enjoyed reading about, I love science, but I was always kind of interested in alternative medicine, and ended up working at the National Lab for a few summers, and I didn't get into med school immediately, so I became a dance instructor. And
dancing.
What kind of dance?
Okay.
Yeah,
Let's talk about that.
Ballroom dancing,
Okay.
and
What?
Latin dancing. So I did that for about full time for a year.
Can we have a course on that too? Is that part of the therapy?
Yeah.
Actually, that actually opened my mind to a lot of stuff, and I think it really helped me understand the
We
body.
gotta do that.
It would be fun. It's a lot of fun, actually. Yeah. So, and what I noticed is if people stuck with dancing for a long period of time, they would actually change their attitude, change their body structure, because they're training their muscles on a daily basis. It's one thing to feel better by seeing somebody, but if you don't do it on a daily basis, usually you revert back. Anyway, so it kind of helped me form some ideas in my head about the body when I started learning about all the anatomy and body work. So it's kind of cool. So I ended up going to osteopathic school and got really involved with manipulation. But a month before I went, I got hurt. I got hit in the face. I was playing some tournament in softball, and a ball took a bad hop, hit me right in the mouth. And my teeth went backwards. Had to get them wired together. And never had pain in my life, and started having massive headaches. And so I went to surgeons, went to all these people, and nobody was helping. And finally I went to a guy that touched my head. It's called cranial osteopathy. And he helped. And then acupuncture helped. And then I had the injections in my jaw, which all together kind of made me get rid of my pain. And that's the first time I was introduced to we call them regenerative injections overall, as an all-encompassing term, and any injection that can regrow tissue. And so that's what got rid of my pain.
Wow.
And so it got me interested in it. And then I did a fellowship during medical school for the osteopathic manipulation, which we also followed people around that did these injections. So it got me introduced to it very early on in my career during school. So every time I would see patients, I would sit there and think, well, what about this? Whereas, I'm following surgeons around. Well, they don't bring this stuff up, because they don't train in it. And
Right.
so, and then even therapists and all these other people. And I always said there has to be a way to integrate this kind of treatment with that. So I started going to courses and learning way back then. And that way, right when I got out of residency, which was in family medicine, I just went straight into my practice. And I was able to open a practice up just doing that stuff. And that came into me meeting some people down in Miami who own gyms, and they were supposed to have back surgery, ankle surgery, and I got them better. And then they started referring clients to me, and they trained, the pro athletes, just everyday people, and also celebrities, and really got me involved in that aspect of it.
Right.
And I found with this kind of work, it's all about referrals, all about, hey, did you
Right.
get better? I got better. Okay.
Right.
Now we trust you, because this field overall is very, you don't know who to trust.
Right.
People come out and say they can do everything for you. And then I've had a lot of people say, well, I've had stem cells that didn't work. And I say, well, how did they do it? And they tell me, and the technique's not always the best. Stem cells, if you have a high quality product, high quality technique, you get high quality results. But if one of those isn't the right thing, then you're going to get a lower and lesser degree of a result. And unfortunately, too many people don't get that.
Right.
And part of that's because, my training was in the manipulation. So I do understand body structure very well. And I can look at, kind of like we did with Rich, like one thing to do is get the ultrasound. We do some stress on the knee, and we can see the ligament open up. Whereas if you do an MRI, let's say, you're just standing there straight. So there's no stress on the knee joint to actually functionally see dynamic testing. And without that, we don't know. And that's where mixing, the x-rays, the MRIs, and the ultrasound together can give us a really good idea of what's going on. And then also hands-on, like I can feel instability. Even a minor instability where people have pain may not show up on any of the scans. And if that happens, then you really have to rely on your diagnostic, because if somebody's having pain or weakness or instability, there's a reason for it. And it's just a matter of figuring out, okay, what is it? And then what do we need? Is it more conservative therapy, or do we need to go to something more aggressive? The typical has always been therapy and steroid shots. But even just last year in one of the anesthesia journals, they compared doing steroid shots into the knee, compared to placebo, and they found the steroid shots actually over a 2-year time period actually decreased the volume of cartilage compared to the ones that didn't have it.
Wow.
And so there's numerous studies on that regard, even surgical from arthroscopy, that shows people have more arthritis and more pain long term than people that had it versus not.
What do you think the most misunderstood thing is about stem cells right now? I feel like there's so much controversy surrounding it and just a kind of an overall lack of knowledge.
Yep, and I think it starts with the term stem cell, because you say stem cell, but you go see somebody, it could mean bone marrow, it could mean adipose, it can mean amniotic, it can mean placental. So there's such a wide variation. So even like, let's say bone marrow, we call it bone marrow concentrate in our circles, and we do fat. We call it stromal vascular fraction, amniotic tissue allograft, or placental tissue allograft. And so there's all these technical terms on the scientific world, whereas in the public, we hear stem cell.
Oh, you think it's Gore Bush. That's honestly, that's when I heard stem cells, I was just like, well, isn't this what they were, fighting about years ago?
A political debate. Yeah.
Yeah, and that's all the embryonic stuff.
Yeah.
And everybody's like, oh, yeah, no, we don't do that stuff.
No.
And then they think, oh, you're doing illegal stuff over there.
Exactly, yeah.
Like, no. So, embryonic injections are actually illegal in the U.S. So anybody doing that would be. But most of us aren't. Most of us are doing all the right stuff. Then it's just a matter of, what's the proper technique? What company do you get this product from? And that's where the more complicated issues arise, because, people think, oh, stem cells, bone marrow here is the same thing as bone marrow there, or fat here is the same thing as fat there, or amniotic or umbilical cord or placental tissue products are all the same, but they're not. And that's where the difficulty comes. That's what I tell anybody. Like, I don't think I'm the only person that can fix and treat people successfully, but it's good to ask. Say, hey, who have you treated? Can we talk to your patients?
Right.
And that's the best information you can get.
What was the name of the, did you guys listen to the Rogan stem cell
He
podcast?
knows.
Reardon, Dr. Reardon.
So I was listening to it, and what I didn't understand is, so it's like two ends of the spectrum. I read a consumer report that I happen to just be laying on my counter about stem cells, and they're talking about, kind of like you were saying earlier, like the abuse of people, because people are willing to pay, an arm and a leg because they hear this is life-changing, and yet they get stem cells. They don't know which kind. It doesn't work. This elderly couple went blind because they injected the adipose into their eyes, like something ridiculous like that. And then I listened to this podcast, and I was like, I'm going to call my dad, and we're going to Panama. This is going to fix every injury he's ever had. So what is it that they're allowed to do there that we're not allowed to do in the United States? And why can't you do that in the United States if it's not embryonic stem cells?
Right. Those are great questions. And I'm not going to pretend to have the answers to all of it. But Dr. Reardon's been in the field for many, many years, decades, I believe, and a very smart individual. And he's done great work and helped the field significantly. But other countries do have a little more leeway as far as what they can do, and also advertise. The U.S. has really made a strong thing about, don't advertise cure, because we don't know right now. We know we're seeing lots of case studies. I attend the World Stem Cell Summit and some other organizations, and we see people from all over the world with a lot of good case studies right now that show this is effective. But the question is, why isn't it effective in everybody?
Right.
And, in that regard, it's nice, and we want to be able to do that, but we also want people to have the opportunity to do it too. And so from what I understand they're doing in Panama, a lot of it we can do here. It's just you don't hear people advertising it. And so finding the people is more difficult than it is down there because of just his ability to do that because of being in Panama. So now one thing we can't do that they probably can do over there is culture expansion of cells, which is where you take the cells, you put them in a petri dish and grow them over a period of time to actually get higher numbers. And there's a lot of debate as to whether that's better or not. One researcher that was at a conference a few months ago, she did research on that, and because what we're looking for is something called mesenchymal stem cells. And so we get that and then expand it. The idea is, okay, we have a greater number. We're going to get better results from it, right? But her research showed that if it was able to basically morph into like 70 different things, for example, after they grew it in the lab, it could only go into 4. So the variability and ability to actually become different types of cells actually decreased, which was very interesting. Now, granted, that's one study, but maybe it's not absolutely the best thing to do. And that's where we don't know right now. That's where we have to look in the future at our research and really find out, and really also come to our experience about what is it that we can do.
Yeah, he's big into mesenchymal cells, basically. That's his bread and butter, apparently.
Can you only get those from umbilical, or can you get those from other sources?
So your fat and your bone marrow have mesenchymal stem cells, and so mesenchymal stem cell is what we call is on a blood vessel, right? And what it does is everybody's called it a stem cell, but in the scientific world, it's not being called that anymore. So this is where that terminology comes into play, because now it's being called a messenger signaling cell, because they're finding it's not a stem cell itself. It tells the stem cells to work. And so we always wondered, if we do IV stem cells and people were getting results in the liver and the brain and the kidneys, why does it work everywhere? Because our stem cells are usually very focused. Like we have intestinal stem cells, we have heart stem cells, we have neuron stem cells, we have all very specific stem cells. So it makes sense if we put something in the body that can signal every single stem cell, it could actually work in every single body part. And that's what we're actually coming to now.
To figure out.
I don't know how long it'll take before the public actually, doing podcasts like this and having the public kind of things where people understand and are educated about it. Maybe it'll go faster. But so we're not really looking for a stem cell anymore. We're looking for this signaling cell. But the mesenchymal stem cell is going to be transformed over time.
Do you do the general injections like that with stem cells?
So I do. It's one of those things, we don't advertise it obviously for those reasons, and making claims on it's difficult. But I do believe, we allowing people to have the opportunity to be educated, and if it's something that they believe they want to do, it is the route to go. But unfortunately, right now we can't say, hey, this is actually definitely going to work. But it's a problem we've had in medicine for a long time, though. You take a medicine or you take chemo for cancer. I mean, there's a chance anything you do may not work. And as you found out with your surgery for your knee,
didn't work.
So it's one of those tough things in medicine. We're not going to be 100%. And the guys that taught me always said that's why it's called the practice of medicine.
Yeah.
It's not called the absolutes of medicine.
Yeah.
So I'm hearing you say you got to find the right practitioner.
Yep.
Somebody kind of knows what they're doing, and then the product. I'm curious about where you get those products.
So, yep.
That was
question.
something too, to piggyback on that.
Yeah.
Because it's kind of the same. Yesterday we talked about, you're talking amniotic, you're talking adipose tissue, fat, and then you're talking bone marrow. And so I've heard you say also a couple of times is, one may work better for somebody. And as I was reading more and more, there's a company out there, I won't say the company, but they believe only bone marrow, that's all that works. And we kind of talked about this yesterday.
Yep.
And so it goes along with the product side. What do you,
Well, if it's bone marrow, it's coming from you.
Yep.
Correct. Or fat, right?
Right, exactly. Yeah, so the two from you is bone marrow and fat, and I've seen good results with both those. At the same time, you have to go through the procedure, and it's not the funnest, but it's doable. But in my experience, the best results I've seen are with the amniotic placental products. And the idea is that part of it's because they're coming from a young person. So the average age is about 30 years old, healthy female that gives a live birth, C-section. And they go through the FDA protocols that they have to, and they're working with the hospital, and the company's licensed to go in there, and they extract this in a sterile fashion in order to obtain these products. And, the idea is that we have a lot of growth factors in addition to the cells, and that actually creates the healing effect that we're seeing. And downside to it is the amount. If we have to do a high volume, the cost becomes a lot higher. But, I definitely see the least amount of downtime and the fastest results with that. But at the same time, these other things do work. And it's just me or any practitioner really just coming up with a plan and trying to decide from a functional standpoint and also a financial standpoint what the best thing to do is. And then also some people just aren't candidates for getting it from you.
Yeah.
And, kind of even in the scientific world, everybody's been surprised. They thought that we'd see some reactions to these cells, right? Everybody's like, oh, no, I don't want something where I'm going to react to. We have to get blood. You always have to do blood types, stuff like that. What we found is these cells are immunoprivileged, which means that they don't have the proteins that we cross-react with. And now that we're getting more and more, we've seen a lot of people do this over about a decade, that we haven't seen a case come out that said, okay, somebody had an immune reaction like that to cause a death or an illness. And, the more people think about it, okay, it's close to the baby, so you don't want the mom having or the baby having cells that can cross-react with each other, because you would have a lot of lost births.
Yeah.
And so now, common sense-wise, it makes sense.
Yeah.
And now we're understanding the science of it a little better and seeing where that goes. Like in your case, we used a placental product from Sky Biologics, and I've seen great results with that. And how you're healing is a testament to
right.
it. With bone marrow and fat, I see more inflammation. So you'll be sore for quite a bit of time.
Right.
So if we need fast healing,
you want to
the
go.
amniotic, placental, umbilical cord products are definitely the way to go.
Right.
If we have an extended period of time to be sore and kind of go through that process, and money is an issue, then scale it back and do a different procedure.
So what's the difference between this product that you're getting from whatever laboratory that you said, I'm sure, that FDA approved, go through all of that, versus them, like we were talking about before, taking their own product in a petri dish outside of the United States and growing 1 billion cells? What's the difference? Why is this one a concern and this one different?
It's not FDA approved.
Right.
In the U.S., we're not allowed to do that.
That's what I'm saying. Like, why? What is the FDA doing differently to look over these than these? Because they were just saying how rapidly they can take umbilical cord and grow 1 billion cells. It sounded not easy, but
right.
they made the process
after you know how to do it, it's simple.
Yeah.
I did a lot of lab work and cell work for a while. And once you know what you're doing, it's a simple process. You need all the equipment and everything, which is pretty costly. So that's part of the reason the cost gets so high. But it's a tough question because we don't know enough about it. And part of defining a cell is certain markers they release. And what they found with the mesenchymals is they're not always the same. And so because of that, since we can't quantify what they actually are, from what I understand, the FDA is a little more reluctant to actually say, hey, this is it.
Right.
And so the scientists disagree on it. So how can we come to a consensus about what to put in somebody's body? Mm-hmm. But, I do see it opening up. The FDA has kind of opened up the idea to doing a lot of this research and even having clinics instead of fighting with the clinics, being more open. Hey, just document your data. And after you document, so you do your internal case studies basically and be like, okay, this is what we're finding, and really just making sure that the most important thing, nobody gets hurt. Mm-hmm. And that's what we don't want. And that's why, even me, it took me years before I actually did a lot of this stuff because I was like you all, just saying embryonic, okay, adult, okay, it's adult stem cells, that's good. And then seeing results and really understanding what those results mean in a positive way. And so not seeing the negative effects is the most important thing. And that's what we want to stay away from. But even, a lot of people say, well, there's other types of injections. So regenerative injections incorporates that stem cell aspect, but then there's platelet-rich plasma injections. There's something called prolotherapy injections. Prolotherapy is probably the oldest out of all of them because it's been done since the early 1900s. And it's just injecting chemicals into a joint ligament to regrow tissue. But it's hard for people and even doctors to wrap their head around how does that work. And, we don't always necessarily know the mechanism of action. Then, many decades later, platelet-rich plasma came around, was used in dentistry, it was used after heart surgery to regrow vessels, help to regrow vessels. And then somebody's like, well, if it's working for that, why aren't we using it for the rest of the body? But the premise of both of those types of injections is through inflammation. So we inject it, you get inflamed, and then what does your body do? It recruits the stem cells, and that's how you start to regrow tissue. And then the idea is, okay, we have stem cells, let's just inject them directly. And that's what we're doing now. And it took a while for our techniques to actually get good enough in order to have the quality of cell we needed. And this is where the mesenchymal steps in, because now we find that's the cell we really like. And another aspect to the amniotic placental products is a lot of times it's a matrix. If we order it that way. And that means it has the placental tissue or the amniotic tissue with it. So your body can actually use it as a grafting agent. So we inject it in there and your body can build new tissue on top of that tissue. Wow. So we get the cellular and growth factor effect, and then we also get the grafting effect. So that's why I think personally for musculoskeletal injuries, I see better results with that than I do the others, because all the others is cellular. There is a little bit of an argument when we take fat out, we can inject some of the fat in the matrix, but it can be degraded more easily than the actual tissue.
Now, I'm not going to lie. When watching the procedure yesterday, that was a big old needle.
It's like this long.
Oh, no.
Can you talk a little bit about, what the actual procedure
Really?
was and what you did with him? And
100%.
You looked, I think only at one point I saw your eyes kind of flash left really hard, like, that hurt. And you were pretty calm through the whole thing, but you were poking around there.
Yeah, it's definitely a rate limiting factor for some people is how many injections we have to do. So in Rich's case, he has a loose MCL. His ACL is a slight loose. He has the cartilage and meniscus. And then yesterday also felt the gastroc attachment in the back of his knee. Felt like it had some inflammation and tendinopathy with it. Right. So what I did is I went to each spot. I went to the attachments of the MCL and numbed those up. Went to the ACL, numbed that up, numbed the joint up, numbed the gastroc up, even did the coronary ligaments on the front of the knee as well as the meniscofemoral ligaments. And so I numbed it up with local anesthetic, just lidocaine. So that's usually the most painful part of the procedure because you feel the initial stick, we numb the skin up, go deeper to the attachment point, numb that up, and usually you feel burning and somewhat significant. Everybody is a little different with their pain scale, so it is a little different for everybody. So Rich did great with it. I mean, rocked it out. So some people don't. Some people one needle, they want to get away.
Right.
But so then I went to the exact same places afterward and re-injected the product in there. And so usually people don't feel that part of it. And usually with stem cell injections, we don't see the after effects of pain. With PRP, I do. I see pretty significant pain immediately after.
Ron.
Yeah.
I was saying how he couldn't. He was just like his shoulders like throbbing for 3 or 4 days.
Is that just from inflammation?
So yeah, everybody hears PRP and they think it's the same thing wherever you go, but it's not. There's different qualities of PRP. There's some where we take the leukocytes out. There's some where we concentrate platelets more. My experience has been I've used about 5 or 6 different product or kits over the years for PRP, and the ones that create that inflammation strong are the ones I got the best results with. So when I see that happen, it's not fun for the patient, but it does work.
Right.
And then prolotherapy is a lot less invasive, a lot less strong. So it takes about an hour for it to get sore, and you get mildly sore. But usually, a lot of times with prolotherapy, you're doing it very often, once a week, once every 2 weeks, until we see you get better. And that could take a while. And that's what kind of got me into PRP. I was doing prolotherapy only. I was getting great results, I thought. But I had some cases that weren't getting better. So a guy came in and goes, "Hey, why don't you try some PRP?" I'm like, "I don't need that." He's like, "I'll give it to you for free." He's like, "Take 4 people that you have, 4 patients, and use it." I did. They all got better after 1 treatment. Wow. And I'd done like 7 rounds of prolotherapy. Jeez. And so I was like, okay, maybe I'll read into this. And so I started doing it. And then I phased out prolotherapy. I started doing PRP only. And then same thing happened. There's people that weren't getting better with PRP. And these companies came in and said, "Well, have you done stem cells yet?" I was like, "No." And they're like, here, try it. And I did, and they got better. And so that kind of was my progression from Prolo to PRP to stem cell. And then I got into then I did all the types of stem cell that we talked about, the bone marrow, adipose, SVF, amniotic, umbilical cord, placental products. And that's where I've kind of came up with my own determination as to what works
Which
better.
one works.
And also, with the injury too. So
What athletes and injuries, or I guess people in general, are the best candidates for stem cell? Like, what population, like if you have a knee injury or shoulder injury, should like come see you now because this will make a huge difference?
right, it's that's the most difficult thing to determine. But we generally say the younger population, any tendon or ligament injury can be fixed pretty well with this. Complete tears, we don't believe so. Complete tears, we believe we have to reattach it, and then we work to help the healing process from there. The more difficult things are arthritis. I've seen great results with meniscus injuries. Like I said, any kind of a rotator cuff, elbow, the epicondylitis, the injuries to the wrist. I've treated a lot of athletes with wrist injuries. But of course, knees, and knees are the most common because almost everybody has some type of knee issue, MCL, LCL, ACL, meniscus. Ankles, I've seen extremely good success with ankles. A lot of, twists that happen, whether it be sprains or even arthritis. I've seen extremely good results in the ankle, more so than almost any other place. Hips are the most difficult, but I do see a lot of glute medius tears that do well. And piriformis injuries and SI joint. I do get a lot of good success with the spine. That's kind of what got me into it. This gym owner, 34 years old, was supposed to have spinal surgery. He was having severe pain, and 2 surgeons were like, yeah, you have to have surgery. Wanted to fuse his vertebrae together, and we did the injections, and he was actually good till for 6 years after we did it.
Wow.
And we just injected him again. Now that I've kind of advanced my practice, we use pure stem cells this time. And he was pretty bad off. We did it, and within 4 weeks, he's back to full activity.
Jeez.
So the recovery from stem cells compared to surgery, I mean, it's just so much quicker.
Surgery sucks.
Rich keeps getting up because he's the engineer today. He has to keep checking the camera.
Nice.
I actually heard you talk about hair loss. So outside of sports stuff, what's happening with?
Yeah, so we can inject it right to the scalp. And the idea is if there's still a hair follicle there, we can make that hair follicle grow. Usually a hair follicle has 2 or 3 hairs in it. And when you lose it, it loses the hair one by one and also decreases the size. So the idea is to regrow, put blood flow and cells back there that can help that to make a difference as far as thickness and the number of hairs in that follicle. We don't see it work in everybody. And why not? We don't know. We see it work better with women than men. We think that's because of a hormone thing because, you don't see many bald women rolling around, but guys, you do.
Right.
And it's usually because of the way testosterone is converted to DHT, and that creates that hair follicle to lose it. So, it's nice to try to find out why, but if we don't know, it's really hey, we can try it and see if it works for you. I see it work more consistently for like the face. I do see that almost everybody sees a difference with it. It's just a matter of how much was that difference. And then doing it for other things too, scars and stretch marks and even getting into the penile shots, vaginal shots and things like that to help different
We
things.
listened to a podcast. What was that dude's name?
Ben Greenfield.
Yeah, he was
on
talking
Rogan,
about.
and he was talking about how he did all these tests on his part, and he was talking about getting stem cells injected.
Well, I
was
think
just
it
like,
was men's
Men's
health.
Health. It was a
They
Men's
hired
Health
him
article.
to test
gas station
dick pills, ultraviolet lights, all
Yep.
kinds of things for male performance, all the way to stem cell.
and he did stem cell injection. I can't even imagine.
Did it work though? That's the question.
He said the stem cell he got the best results out of.
Yeah,
It's just scary.
yeah.
I don't want to.
What type of stem cell did he use? Did he say?
He did. I think he did the bone marrow, right?
It was bone marrow.
Bone
'cause
marrow
it
or
was,
fat? I can't remember.
because it was definitely from him.
Yeah.
something.
I must say I've done PRP, adipose, amniotic, and bone marrow. I've seen the best with bone marrow
Yeah,
in the penis. It's been interesting.
it was funny to listen to him. He was like,
He swore by it.
he's like straight up, I'm bigger.
Yeah.
Performance.
My wife's happy, kind of a.
No, it really does work. It's pretty amazing.
You don't think about like anti-aging kinds of things initially when you think about this. At least my mind went to sports injury kinds of things, and it's such a bigger realm of possibility.
Exactly, and most people, they kind of accept getting older. That's just part of the aging process, so they don't really think about it. Sports, if you lose your quality of life, you start sitting at home because you have pain all the time. I mean, usually we facilitate our downfall when we stop moving. So life is about movement. It's about being out there and enjoying life. It helps your mind and it helps your body. I don't know if you saw that study about people who sit at a desk and the health problems they have. It's like as bad as like smoking. I can't remember so many cigarettes per day.
Yeah, makes sense.
It's really bad. So, we want people to be active. I want to get people out there, not just for their physical, but for their mental well-being.
Do you think over time, like I don't have any idea what the cost scale of it is, but do you think over time availability will become easier and people will be able to go into a clinic and visit you or someone else and address all of these other issues that aren't necessarily life-threatening, but things that, okay, well, I'd like to feel better here or do this or,
100%. I think every new thing out there, it starts in that infancy stage where, the cost is just astronomical. And then as time goes on and people are doing it with high quality and we understand what that is, we can mass produce it or get the right technique to actually make it more cost effective. And it's just a matter of time. It's going to be research. And like one of the products I use, it was a private company, and then they called me. They go, hey, we have a pharmaceutical company looking at our product. Do you mind talking to them? I was like, no problem. I ended up talking to them for like an hour and a half. There were 5 executives, and we were just talking about the results, the effectiveness, the side effects, and they were like, okay, that's all we need. Do you have any questions? I was like, yeah, I just have one. I was like, how many doctors have you talked to? They're like, like 20. I was like, what do they say? Yeah. And they say the exact same thing as you. That they get great results and no side effects. It sounds almost too good to be true, but that's where we're headed with this type of medicine. We're headed toward a great place, and it's just a matter of, okay, how can we make it cost effective and even get insurance companies involved? And that company's actually been bought out again by another pharmaceutical company, and it's on that track to get reimbursed, and hopefully one day soon, because this is a great thing to be doing before you go to therapy, before you get steroid shots, because what I find, especially coming from a manipulation standpoint, is when you have an injury, your body compensates. All of a sudden, muscles tighten up that shouldn't have before, and it's all because of the injury. And so if we regrow that tissue, the compensation patterns disappear, and then therapy is more effective, and then your workouts are more effective, and you can actually get back much more quickly than you would otherwise.
Wow. So you have 2 locations. You have Knoxville and Miami. How readily available are places and doctors like yourself to visit to do this? So you have 2 locations. Are they prevalent? Are they not prevalent?
Correct. Yeah. It's a different mindset. It's interesting to be in 2 cities. I grew up around Knoxville in a small town. And so I kind of understand Tennessee and the people there. Miami's, we have a lot of people come in and out of town, and I get a lot of people from overseas come in actually.
Wow.
And so it's interesting to see the different thought processes. Knoxville is a very educated city. We have the National Lab, a lot of tech companies. And so I get a lot of questions in Knoxville. Like they've already read about every single stem cell, and they're like, okay, we just want you to tell us why, why would you use this?
Right.
It's really interesting. But so it is difficult, but a lot of this, people understand that it's not around the corner everywhere. And so they're willing to wait. They're willing, if you're going to do good work with them, they're willing to be like, okay, we'll plan this out. And most people aren't jumping into it. Hey, I want to do it today. Let's do it in next week or a month later.
Well, the hard part too is Prolo, PRP, or stem cell isn't covered by insurance most of the time.
Correct.
Like I had when I had my meniscus, they did PRP, but I had to pay extra. Like my insurance covered the surgery, but I had to pay an extra $600 because they did PRP in the joint after the surgery.
Exactly.
And you're just like, that's kind of weird that you're already in there and you still had to pay for it, which is kind of crazy to me.
Why would insurance not pay for the actual thing that's healing?
Because it's still technically
experimental.
It's not.
What?
Yeah, it's not FDA approved. None of that's really FDA approved, which is it's crazy to me.
Well, and I've gone through, like, there's lots of research out there, and you'll see conflicting research, and it kind of goes back to what we talked about earlier about there's quality of products and then there's technique. And really technique also means proper diagnosis too. A lot of people inject a knee joint and they're like, okay, we're trying to heal the meniscus and that. But the question is, why did it happen? And I look at it like a car engine, it bolted together, right? You have the bolts are like the ligaments, and if they loosen up, what happens? You start to corrode your pipes in your car, right? And I think the ligaments are the same thing. If we don't tighten up those ligaments, we're going to keep wearing down by friction, more of a mechanical than biological. So we have to account for that physical as well as the biological, and that's when we get our best results. But there is a lot more research out there, and I've had insurance company lately be like, okay, we want you to give us research studies. And so I've had to get together the ones that I see that are positive. Of course, there's always, okay, do we pick the positives and negatives? But obviously we're only going to give them positives. And hopefully we expound upon, okay, this is obviously working, but why? And then research studies can be made in the future. Unfortunately, usually a lot of variables put in there, like, okay, you're only allowed to do a knee joint injection. Well, if we don't, like I said, we don't address those ligaments, are we really going to get the best results? And I find that I don't. So if I do the whole thing, though, is when I get the ideal results. So it's going to be, I don't know how long it'll take. Hopefully it facilitates quickly, but I think the demand, part of the reason it has progressed to this point in the U.S. is because I think of the professional athlete world. They were flying over to Germany. I guess Kobe probably made the biggest note about it. And then Tiger went up to Canada to have it done. And so these guys really, I think doctors in the U.S. are like, okay, something's going on in a positive way. Why aren't we doing this,
So you think if somebody's had a negative experience, it's probably a mixture of inferior product and inferior technique, you think? Most of the time? Is that safe to say?
I really do, yeah. I get really good results in my clinic, and I take pride in it too. Like,
right.
If I don't, I'm going to find a way to make it happen.
Right.
At the same time, I don't believe anybody can treat somebody 100%. I trained in medicine. I was with surgeons, with regular docs, with therapists. I trained in acupuncture and manipulation. And one thing I'll say is nobody fixed everybody. And there's always something that we just can't quite see, or it could just be the DNA of the individual. Maybe something's going on internally that's not allowing that to happen. And that kind of segued me into the other part of my practice, which is more functional medicine, but very aggressive functional medicine with intravenous therapies, nutrients, with I do ultraviolet blood therapy, ozone blood therapy, just trying to find a way. Why is the body not healing the way I think it should?
Can you tell us about those a little bit? What do those entail?
So intravenous nutrients is using vitamin C, B vitamins, magnesium, arginine,
Jim got to do that yesterday.
Yep. Yeah. So how did you feel after doing it?
I think I tell you what, it didn't hit me until probably later in the evening. I text Rich. All of a sudden I was going to the bathroom. Like 3 or 4 times, feeling like I'm way hydrated here. And I think overall I felt maybe just clear-minded. It wasn't anything that was like, life-changing. I couldn't say that like immediately where I knew, but I felt good and I felt clear-minded at the end of the day. And
how do you sleep?
I slept really good for most of the night.
Okay.
And then woke up, but there's also a lot of heavy things going on right now that had to do with that, I think. So, why is this the most controversial part of, if you go online and you research this topic, this is the most intravenous stem cell therapy is the most controversial. So,
well, it's because we don't want to give false hope to people, and have them spend their money on life savings and all of a sudden it doesn't work. So that, while most of us are doing it reputable and upright, there are people out there just looking to get some money out of it.
Right.
And, one of the biggest questions I have from people is, how do I know where you're getting it from?
Right.
And how do I know it's real? And unfortunately, it comes down to trust. I'll give them the company names I use, but, people looking that up, they don't know any better,
Right.
So I have these companies actually fly me to their places. I look at how they do things. I really want to know, because otherwise, if I wouldn't do it to myself, I wouldn't do it on my patients. But it's mainly false hope and not having people waste money. And that's why we have a lot of case studies. I'll tell people, like, a lot of good information out there, a lot of case studies that show promise, but it doesn't work in everybody. And, you know, having that knowledge ahead of time and just understanding that, you know, this is something that might work, but it might not work. And just, I feel like if you're honest with people and give them the right information, then they'll make the decision themselves and see if it's right for them. But the intravenous stuff, even the nutrients, like 30 or 40 years ago, those were considered extremely on the fringe too. And doctors even went to jail for it sometimes.
Wow.
But now that's becoming a regular part almost in every state of the country right now.
Yeah.
And, you know, we all are composed of vitamins, right?
Yeah.
And so we need it.
I'm a huge believer in that. I already do it. I mean, I have a regiment that I take every day, so it's not much different than what I'm already doing. I'm just doing it orally, you know?
Yep. And so the oral, you absorb roughly about 40% of what you take in.
Right.
Right? Then if you have gastritis, if you have stomach issue, you're probably absorbing less of it. And so when we do it IV, we just know exactly. Have a gram of vitamin C, it's all going in your body right there. So I can be a little more precise with what I'm doing. And usually most of my patients either have been to a lot of people if they have an illness and they've had all these oral supplements. They've been to naturopaths, acupuncturists, their doctors, and nothing was working. So I can be more aggressive that way. Or the athletes. My athletes that do the IVs notice they recover faster, they do more weight at the gym, and they're coming in. The pro athletes coming in once a week or more sometimes, and they come in because they feel it. They typically don't like to come in unless they have to.
Right.
CrossFitters, we can only take 100 milliliters every 12 hours. Is that what we figured
Yeah,
out?
we looked at the USADA and the WADA, so it's 100 cc's every 12 hours. So we do have to be aware of that.
Yeah.
And, you know, every sport has its own little rules. So, unfortunately.
But, yeah, I think one of the coolest things about working with you has been, you know, I was taking that meloxicam, and everybody's like, oh, yeah, just keep taking meloxicam. He was like, stop taking meloxicam. He's like, let's try some other stuff. So I've been taking some, you know, a lot of turmeric, curcumin, what else? Deer antler, trying that. But just a different approach to getting the inflammation out instead of just trying to mask it with a drug has been kind of a cool thing to do too. Because I mean, literally for a year I was on meloxicam, and if I didn't have it 2 or 3 days, my knee would just swell up. And so I haven't had it since we started, so about a month now, and so I've actually have less inflammation.
Wow.
And so that's been cool.
Really cool.
And I've cleaned up my diet and am doing some different stuff like that. You know, less sugar, and it's helped a ton.
Right. Well, and, you know, it's hard at first, even for a doc, you know, to look at this stuff and be like, okay, this can work. And we want you to get off these medicines. You know, when I first started doing it, I was nervous. I'd be calling people every day. Are you swollen or you're not?
Yeah.
Right. Yeah.
But I tell you, I've done enough of it now that I just know. And that's why I told you immediately, I'm like, get off it.
Get off of it.
Yeah,
I was like,
it's
I
actually
don't know, bro. I don't know. It's kind of what I need. Like,
That was your safety net.
that was safety, man. Like,
Oh,
you know, even with
gosh.
the tendonitis before the meniscus, it was just like Matt Hewitt was like, hey, I've been taking it because he had his knee thing because he had a meniscus surgery 2 years ago. And he was like, with my tendonitis, he was like, try it. And like the next couple days, I was like, man, it hurts, but not nearly as bad. And then, so I was like, all right, something's to this. And well, then it was just like, it's not like a pain medicine at all, but it's, you know, it's inflammation. And so I was just relying on it where I was like, man, I need to have this every day, you know, 1 pill every day. And so I haven't taken one for a month. So
well, what the NSAIDs do, which that falls in there, and the prednisone or whatever it might be, it hides your pain. And so it didn't fix your pain, or the reason why you had the pain. And so what happens is you feel good. So what do? You start working out like you were healthy, and then you get more degradation of the joint or the ligament tendon, and you end up with more problems down the road. And that's why I call it the controlled declines. You know, we're really good at controlling your decline.
Yeah.
But how do we reverse that? We want to get back, you know, and that's been my goal. And when I started seeing these injections, man, 15 years ago now, crazy.
Wow.
I started seeing it, and I was a science guy. I told you I had a biochemistry degree. I worked at the national lab. Everything was supposed to be exactly on point, but then I got hurt. and it didn't work that way. And I was like, okay, something's not right. And so it made me change my mindset about how I looked at the world and how I looked at data. And sometimes it's results oriented. And unfortunately, because most big, the FDA, the insurance companies, everybody wants these big global studies. And it's nice if we can make it and find those, but in the meantime, we see results. And if we see results, how can we say, no, we can't do this? You know, and that's why I started doing it, because I would see people get better. And once you see people get better in their quality of life, people come at me smiling. You know, they're happy they come back to see me, instead of, oh, no, you know, it didn't work again. What else can we do? And that's why I like to get into it early. I used to wait. I'd go, okay, let's go to therapy. Let's try this. But why? You know, I'm like, let's do it immediately. Let's get you better fast. You know, and so a lot of my patients will be like, I'm going to go try therapy and these other things. Yeah, roughly 2 years later, they usually come back in. I get another call from them.
Do you have a way to like document your success stories? Because obviously you see so many and you have so many people come in. So 2 questions. Do you have a way to document so you can share that, you know, positive message with people? And B, do you have like a favorite go-to piece of literature of like, hey, look at the results. These are case studies and things that are, you know, because it seems like there's so many positive results out there.
Yeah, and that's where I'm a better doctor than I am a marketing person.
Yeah.
But I've yeah, right. So sometimes, well, now I'm getting better, but I'm trying to get a lot of videos, and because I find I used to do written testimonials, and people, you know, you look at it, it's nice, but when people are on camera and you see their face, you know, you get a better sense of, okay, they're actually telling the truth.
Yeah.
You know, but I'm trying to get better at that stuff, and my issue's been I run 2 practices,
busy,
Knoxville, Miami, and so me doing the clinical side plus the business side, I just haven't been able to put that data into something.
Absolutely.
But my goal is to do that. I would love to do that. And, you know, looking in the future, you know, I want to gather like, okay, we're doing this many knees and this many shoulders, everything, and that way we can show people, okay, what did we use and how did it work, and long term, how many years later are people still doing well?
We'll have a video of my whole process.
Yeah.
We've kind of documented it throughout the whole. I
was going to say, that's what this is kind of about, getting connected to athletes like this that have a little bit of profile where you can really watch it work.
Exactly. And I tell you, it's been a blessing, you know, because, you know, showing people from the beginning through the process and having people understand, you know, okay, so somebody at that level can do what you do after doing this, like getting off the meloxicam and then actually working out again. And I'm really looking forward to this next month when you're doing, I really feel like the Olympic weights you're doing
coming back.
Yeah, really going to even progress even further.
Yeah, it's just been nice to be able to squat with some weight again. You know, I've easing back into it, but I can squat and not having, you know, the next day my knee feel like it's going to explode. So it's been good as long as it's under control right now. Like I said, the Olympic stuff is still a little, we're working on that, but the just being able to control squats feels good.
Right. Yeah. So yeah, it definitely helps, you know, doing the I've realized, before I would just do it after, right? Now I'm getting more of the befores through the process and after. So I'm getting better about my mindset about, okay, I see, now I understand what people want to see, you know. It's one thing to, oh yeah, I got better, okay. But now we see, okay, this is how you're working out, and now here's where you are. Yeah. And how quickly it happened too. I mean, and then people also want to know how long is it going to last.
Right, yeah.
But once we regrow tissue, it's going to last until somebody gets hurt again.
Right.
And yeah.
Do you have, what are your hopes for the next 5 years in terms of this therapy? Is there any progression you're hoping to see? Any new doors open? Or are you pretty satisfied with where it's at right now?
Love where it's at. I always feel like we can always learn more and do better. Like also, you know, one aspect I didn't get into with the research, like not only are they transform from that mesenchymal stem cell to calling it a messenger signaling cell, they're actually looking at the chemical reactions that the cells are actually releasing. So it's possible that we may not be talking cells in 10 or 20 years. We're talking the chemicals they release. So it's fascinating. You know, I worked, you know, when I was in school for biochemistry, we were at the beginning of talking about how to cryopreserve cells. And now I'm working in the field that they're actually doing all that.
Yeah.
Wow.
It's kind of cool.
Crazy.
But for me, my goal is to build a mindset. Like what's different than me than a lot of docs, this is all I do. I don't have a surgical practice and I add this on the side. I don't have a medical practice. I add this on the side. All I do are these injections and focus on stem cells, PRP, prolotherapy. And so I feel like, me engulfing myself, if you're going to get good at something, you just throw yourself in it. And that way you become very knowledgeable yourself and do it. And so I want to get practitioners who also believe in that, and we can do across the board. I'd love to have a surgeon involved. It'd be great because there's instances we need it. We're not going to be able to regrow everything with stem cells. So having that, sports medicine, functional medicine, that's all they do and work on with the nutrients and the stem cells. So I'm hoping really to build the practice to a point where we can have a center. Even in Knoxville, from a cost standpoint, real estate and everything is a little easier to build anything than Miami.
Yeah.
So my goal is to actually build a kind of a center that we can actually have 24-hour access for people that are very sick. We've talked a lot about sports today and injuries, but not too much the health concerns. I do treat some very sick people, and sometimes they need something that's a little more aggressive. And so I'd love to have a facility where we had a surgical room. We had these 24-hour rooms where people could be there if they needed it.
Oh, that's awesome.
Real estate's cheap in Cookeville too.
Actually, I heard there's a mall coming up.
Yeah, they're building some whole, I don't know, shopping center over there. But yeah.
Well, I tell you probably have space right around on some land right here.
Space right in here next to us.
You want to take a tour?
I had dinner with my in-laws last night, and they just got back from vacation. And my mother-in-law is probably 70, 78, and she met a researcher from Canada, and he talked to her about stem cells. And she asked me last night, "Do you know anything about this?" And I said, "As a matter of fact,
Tomorrow I'll know even more." Yeah.
That's very cool. Well, I tell you, everybody's talking about it, and then it comes down to who's doing it good, proper. Right. And really, to me, it's about communication, like talking to people honestly and be like, hey, I love to go to conferences. I love to learn. So I try to attend about 3 or 4 a year that are focused either on the musculoskeletal or on the global aspect of stem cells for health. And that way, every year, this field progresses so rapidly. If you don't keep on top of it, you'll be talking about something that happened 5 years ago, So you really have to go and do it. And so I love education, and that's why I need other practitioners there too, so we can all just learn from each other and help. And that's the good thing about this network, though, in the stem cell world is after we find each other at these conferences, we keep in touch. So I talk to docs all over the country about what are they doing and what results are they getting? And we all tend to have our little niche, Like I'm very unique at doing the body and the musculoskeletal system. More the IV stuff, anybody can develop a protocol for that kind of thing, so it's easier to replicate. But doing the musculoskeletal system is very different, much more difficult to get those top-notch results. But it's been interesting. Like, what I see in Miami too, I'll get people from overseas, and they'll come from Germany, they'll come from Panama even, and they're like, well, nobody does it in our country. And it cracks me up. But it just shows, a lot of times we look for things outside of where we are, and it's more exotic.
Like you said, you can't really advertise it because you're kind of stuck to where you're like, you can't really tell a bunch of people because you can't make false claims. But if something's worked before, and we kind of talked about at the beginning with the negative connotation of stem cells. You're just like, you can't put a billboard up that says we inject stem cells. Like for some reason, people, it's just it's taboo right now. So
that's so true. It definitely makes it harder. So that's why I rely on my case studies, like have my patients talk about it.
Yeah,
and that's where most of it happens right now.
It works.
Definitely.
Cool. We're about an hour, so let's we'll wrap. Where can people find you?
So I have an office in Knoxville, Tennessee off Executive Park Drive, and in Miami, Florida, right in the Design District. Okay. And my website's www.theosteocenter.com, and visit us there, our phone numbers, and you can learn information and see more about what patients have said, and hopefully it's something for you.
Yeah. We'll have you back on too, because you passed through, and I think there's still more that we can talk about and figure out. So
great.
Appreciate it.
Thank you. Appreciate
Froning
it.
and Friends, episode 22.
I think.
That's what you said at the
22.
beginning.
Yeah,
22.
22. We'll go with 22. Maybe 23. I don't even know.
Yeah.
CrossFitMayhem.com, FroningandFriends.com.